My name is Colette Magnant. I am a breast surgeon and have been for 31 years. I am the director of the Sullivan Breast Cancer Center at Sibley Hospital. Although African American women are less likely to develop breast cancer in their lifetime, they're more likely to die of breast cancer because they develop types that are much more aggressive. Many people think that breast cancer is just one disease, but it's really not. It's very heterogeneous. It can be a very non-aggressive type of disease, or it can be a very aggressive type of disease. The way we treat breast cancer in a breast center is what we call a multidisciplinary approach. We have a whole team that really approaches the patient. The team is composed of a breast surgeon like me, a medical oncologist who's the person that gives the patients what we call systemic treatment, which are things like hormonal treatment or chemotherapy. And then there's a radiation oncologist who is an oncologist who specializes in giving radiation to patients with breast cancer. Likewise, we have a geneticist, because especially when women present in their early years with breast cancer, we want to see if there's some sort of a genetic component to it that might set them up for other cancers as well. So the main options for surgery when treating breast cancer are to do a lumpectomy, where we take out the tumor with some surrounding normal tissue. Then we sample the lymph nodes under the arm, because that's the most likely place that the tumor would go, and what we call a sentinel node biopsy. And then we have to do radiation after that. The other option is to do a mastectomy, where we basically scoop out all the breast tissue, sample the lymph nodes as well, and then do some sort of a reconstruction. And our number one goal is always to take care of the breast cancer. But our number two goal is to have the patient end up feeling whole. Don't be afraid to go in if you feel a lump, if you're worried about something, if you have some blood coming from your nipple or something like that. Breast cancer is a highly curable disease. So the important thing is really to get in, to get it checked out, and to go on to treatment if you need to. And most women with breast cancer are cured. When you look at the long-term survival rate of women with breast cancer, it's around 85%. So although you kind of look at the other 15% and say, well, wait a minute, that's not that high. If you think of all the patients with breast cancer and the different tumors they have and the different stages, that's actually a very high long-term survival rate.
Visit our website at ncbwdc.org for more information on how you can get involved in our initiatives.